Today's hearing examines one of our government's most important agencies, the Centers for Medicare and Medicaid Services at the Department of Health and Human Services. Called CMS for short, the agency is responsible for administering the country's two largest health insurance programs, Medicare and Medicaid, which cover nearly 100 million Americans at a cost of over $600 billion. As the largest single purchaser of health care in the country, CMS has enormous power to do good or do harm. Medicaid is funded jointly by the federal government and the states. It covers more than 60 million low-income Americans. Medicaid is the largest insurer of infants and children in the United States, covering more than 28 million kids. It's also the largest insurer of people with disabilities, covering almost 10 million people. Medicaid is the single largest source of funding for our nation's public teaching hospitals, children's hospitals, and community health centers and public clinics, programs that benefit not only the poor, but everyone in their communities. Unfortunately, little notice has been paid to a series of Medicaid regulations proposed by the administration over the last 10 months. But these proposals would have enormous impacts. They are, in my opinion, a thinly disguised assault on the health care safety net. If implemented, they would cause major disruptions to state Medicaid programs and the people and institutions that depend on them. In total, the proposals would shift at least $11 billion in costs to state and local governments, the largest Medicaid regulatory cost shift in memory. Since these are federal matching funds, the real cuts in programs at the local level could be at least twice this amount. This would force states to make a difficult choice, either raise taxes or cut vital services.
Good morning, Mr. Chairman, members of the committee. My name is Twila Costigan. I live in Helena, Montana, and I just want to make it clear that we do have plumbing in Montana, okay? Even though we live way out there in the West, we do have it. I'm here on behalf of the Child Welfare League of America, the Montana Children's Initiative, which is a group of providers in Helena, or across the state of Montana, and Intermountain Children's Home. Intermountain Children's Home is a magical place where we seek to restore hope to children and their families. We deal only with children with serious emotional disturbance. I'm going to talk to you a little bit about how kids get to be SED, or seriously emotionally disturbed. I want to talk to you about two kids. One's name's Johnny, the other's name is Susie. Now, Johnny is a young infant. As we all know, the first 3 years is when your brain is going crazy up there, wiring, making you who you're going to be, giving you the skills that you will need to be successful in the community. Johnny lays in his crib and he cries because he needs his diaper changed, because he's hungry, because he's just not comfortable with where his mom is or his caregiver is. And somebody comes to Johnny. Somebody picks Johnny up and somebody looks at Johnny and says, "You are beautiful. You are my son. You belong. I love you." I want to talk about Susie next. Susie cries because she's hungry, or she needs her diaper changed, or she's just not comfortable with where people are. She doesn't feel safe. For Susie, people don't come often enough. People don't pick her up and look in her eyes and talk to her and tell her that she's beautiful and that she's loved and that she belongs. Susie will probably someday be a seriously emotionally disturbed child, removed from her birth home, in the custody of the state, placed in foster care homes, maybe more than one. The average placement is 3. For Susie, and for Johnny, and for each and every one of us, we are born with a drive to have relationships with other people. It's what we're here for. After a while, kids like Susie quit crying. Nobody is taking care of them, and they are not going to let anybody into their world. These are the kids who most severely disfigured by adults in their life. Susie is driven to attach, to connect with this other human being. And for our seriously emotionally disturbed kids, most of the time that adult that they're driven to attach to is the one who provides the trauma that leads to the serious emotional disturbance. In Montana, we have a continuum of care. We provide services in the home, in the birth home, to try to keep kids in the home, which is always the best option. We have short-term foster care. Some of those kids are placed in adoptive care. The seriously emotionally disturbed children are a very small percentage of the kids who are in foster care. Most of those kids either go back to their birth home, about 77% in Montana, or a relative, or they're returned to the other parent. A small percentage of them are adopted. For our program, the rehabilitative services allow us to help these kids, to bring hope into their lives, to provide in-home services, to help their parents learn how to deal with them. Our continuum of care is the preservation in the beginning, in the birth home, foster care, therapeutic foster care, therapeutic group home care, residential treatment. The rehab services are a huge piece of the funding of therapeutic foster care and therapeutic group homes. It's really important for these kids to have some hope. And so I ask you, as you deliberate, as you think about this, think about Susie, who cried and cried and cried, and nobody came to help her. Keep the rehab services intact and allow places like Intermountain and other wonderful places across the nation to provide hope to these children who are our most vulnerable citizens and dependent upon us as adults. Thank you.
Thank you very much, Ms. Costigan. Ms. Herman?
Thank you very much, Mr. Perella. Ms. Costigan, I just wanted to talk to you for 1 second about foster care. One of the proposed regulations would, as I understand it, require therapeutic foster care homes to unbundle their services in how they bill for those services, creating, at least at first view, a whole new level of bureaucracy for families that are looking to take on some pretty difficult and emotionally complex children. What do you think the effect of that proposed regulation is going to be on efforts of states that are already difficult as it is to try to get parents to come into the therapeutic foster home system?
I think it will be very destructive to any recruitment efforts. I also think that our agencies will not have the ability to track everything by 15-minute increments, especially when what we're talking about is giving kids back a social life, giving them skills to be able to have a friend and keep a friend and be a friend. I think this Medicaid rule will eliminate the support that therapeutic foster parents need. And if we want permanent homes for our kids, which is one of the things that Intermountain is very interested in, is permanent homes for seriously emotionally disturbed kids. We do a therapeutic adoptive care, but we fall under therapeutic foster care. If we want these homes for these kids, we have to be willing to support them and to help the child grow.
Let me just say that any others have any comments as to what this will do to your facility in terms of, if these cuts go forward, as to what would do in terms of to your facility in terms of if we do not rectify this? Yes.
We run an adoption program in Intermountain and Helena and Great Falls, Montana. If this rehab rule stays the way it is, we would potentially lose that program. We've served over 100 SED kids, and we found permanent homes for many of them, and we've kept them in permanent homes. We have a 73% success rate. The program would be gone.